So we are waiting for one more person to be able to meet our quorum. It sounds like we will have that person here by 9 p.m. or 9 a.m. 9 a.m. Yeah, there's been some really bad traffic around downtown and through the city. So what we're going to do is we're going to kind of go a little bit different order today. We can't really perform any of the business side of the meeting without a quorum, but we will, for time's sake, go ahead and get started with presentation today and record it, and then circle back around for those. Do a roll call to that. All right, so we'll officially call the meeting to order for May for the Board of Health. There is official notice of publication in the Daily Record and via the Open Meetings Act is on the wall of the legislative chamber back there. Let's go ahead and start with the roll call. Here. All right, so jump into the item 4 for the health director's report.
That the Public Health Department undertook with the response with the tornadoes that moved through at the end of April. Since we have been pretty busy really doing that response work and trying to make sure that all of the public health bases are covered anyway. So just so you are all aware, on April 26th, we had a couple of tornadoes that moved through the Omaha area and caused quite a bit of damage in the Elkhorn and Bennington areas, as well as outside of Waterloo. And we actually, at the health department, I have to say, the internal response was pretty darn, it was great. Our staff, I had actually let go for the day starting at 3:30, so people were packing up their items and getting ready to go. And then we discovered that there was a tornado on the ground in Waverly, and at that time, I made the decision not to let people go and to have them shelter in place in the health department, which they did for a couple of hours, and that went very smoothly. It's the first time since I've been here, I think, that we had to actually shelter for a tornado. But we, from there, you know, as the event was ongoing, our emergency response coordinator, deputy director, and I were all in communications and planning for what would need to happen. We were able, because of the media, we could kind of watch this event unfold in real time, so we knew immediately that, you know, there was going to need to be a public health response. And so we were able to contact Douglas County Emergency Management and make arrangements for us to come down to the Emergency Operations Center as soon as it was safe for us to do so. So we were able to do that. And from there, we really jumped straight into response. So we planned for many communications to go out to the public around safety. We consulted with our food safety and our sanitation experts in the health department to kind of gauge what the impact might be there. Our food safety person did end up going out and the very next morning and looking at restaurants that had been impacted by the tornado to ensure that you know, they were good in terms of food storage when they didn't have power, that they were able to get everything back up and running, to give advice if needed on how to get things moving safely. and also helped us to conduct a shelter assessment the evening of the tornado. So we were able to actually go out to the shelter that the city stood up at Common Ground in Elkhorn, which is a beautiful facility. If you're going to have to stand up a shelter, that is exactly the sort of place you hope is available, because it is clean. It has really ample facility to have people there. And they were extremely collaborative, and just it was a very smooth process for us to go out and do that inspection. There was no concern that we noted doing that inspection. We also started working right away to plan to set up a tetanus clinic. So we knew that anytime we have cleanup efforts after any kind of disaster such as this, there's a fair amount of injury that comes from just cleaning up. And so we did start planning for the tetanus clinic, finding out how much tetanus vaccine we actually have on hand. There are some nuances around how you can use vaccine depending on what source it comes from, and so we had to also work with the state to make sure that we were okay to use our tetanus vaccine for this. And we also sourced it from a couple of other agencies around town if we would need it. So we were very grateful for our other partners in the community who were willing to allow us to either buy it or borrow it from them and replace. And we were able to get that vaccine clinic stood up less than 48 hours after the event, and we ended up vaccinating, I believe, over 100 people. So that was fantastic, and most of those people who came in did have some level of injury. We had nurses there, so they were able to assess people and, say, hey, you probably need to go get stitches or, more care for this injury, or, okay, this is minor, let's give you this, here's how to watch for infection, that sort of thing. So that was really good. They were also able to look up vaccines for people. So I don't know about you, but I don't actually remember when my last tetanus shot was. So it's very helpful if you have somebody who can pull up the registry and actually check that. So they were able to do that, and there were a few people who came in who didn't actually need it because they'd had it recently enough. So that was an incredible success, and we're really, really proud of how quickly our team was able to put that together. And we're very grateful to Common Ground for allowing us to use their space in the shelter to administer those vaccines. So that worked out very, very well. We were lucky that there did not appear to be too many impacts in terms of sanitation, but we are keeping an eye on that as we've had a lot of moisture. Things like, if you've got a lot of debris laying around, that can create places to harbor all sorts of pests, such as mosquitoes or mice. And so, we're kind of keeping an eye on that and reminding people that, hey, if you've got standing water, make sure that you're addressing that standing water, make sure that you're using DEET, things like that. If you've got a lot of debris, the quicker we can get that cleaned up, the better. And just making sure that that education is out there. And we also did put out education to the public about, if they're up in Bennington, for instance, they do have some people who are on wells. Most other places in Douglas County really aren't. They're all on municipal water, but we do still have a few on wells. So just providing education about how to ensure that that well integrity was not breached due to the storm, and if it was, how to safely access the water in that well. So there were a lot of things happening, lots of communications. We are now working to conduct a CASPER, which is a rapid assessment for emergency response. And what this is it's an assessment survey that goes out to impacted people. It is structured somewhat like a research study, but it is not research. It truly is an assessment meant for immediate response there in a community. So this doesn't need an IRB or anything like that. We were unfortunately not able to go out to do door-to-door work with that survey, which would be the preferred method that I believe the framework calls for. But we are going to be putting out the survey on the internet. We're actually doing a random sampling of people in the impacted area, and we will work to gather about 210, I believe, surveys as the sample size we're shooting for there. And then that is going to help us learn a whole lot of different things, and we'll be able to share that with partners that were involved as well. So it does ask questions about how did you get your news about the tornado as it was, as the storm was ongoing? Did you hear sirens? Did you, basically there are a whole lot of questions. And then delves into, are you able to get the services that you need? And asks quite a few questions around whether people were able to get their needs filled. And that way, we can take that information and immediately use that. So for instance, let's say we discover that a lot of children are having mental health impacts from this. I can imagine there are probably a lot of kiddos that are pretty scared every time it rains now. I have a little person who wasn't, we're in Millard. We're not in the path of that storm necessarily, but even he struggles now every time we have a little thunderstorm come through. And so I can only imagine, what kiddos in Bennington and Elkhorn might be experiencing. So if we discovered that that was an issue, perhaps we need to work with our Region 6 partners or others in the community to provide more services to support those families. So that survey will be going out in the next week or so, and we're really looking forward to that and encouraging the public that if they get the link for that, we really ask for their cooperation to complete that survey. It should only take a few minutes of their time to talk to someone to fill those out. So that will be something we're doing, and we'll provide the information that we get from that. And we are partnering with UNMC to get that work completed. So that's my big department update. We've been doing a whole lot in the last few weeks around tornado response.
I did think it was an amazing community response. I think overall, all from the volunteers or businesses that were jumping in and the health department role, how fast everything came together. It was pretty great to see like that. So
it really was. I actually had the pleasure of going to Junk Stock last weekend, and I was completely blown away at. You could see right there across the road, that the trees had been decimated from the tornado coming through. I know they had quite a bit of damage out there, but it sounds like they had kind of volunteers en masse that just showed up and said, hey, we're going to make sure this is still going to happen. This is a big deal for our community, and had it all cleaned up and things ready to go. And really, while you're in the event, I would have never known that a tornado had just come through. And so it's really impressive the way our community came together to assist each other, after this awful, awful event.
So it would be better to just go ahead and do a presentation now and circle back?
Sure,
Okay.
We can absolutely do that.
What do you think?
All righty.
Yeah, right. So do you think we go ahead and do the votes? Oh, not that. Okay.
Do you want me to send him a quick message? He may have already left. Can we pause for 30 seconds? Wonderful. I'll just send him a quick note.
Oh my God.
All righty. Thank you for your patience there.
Okay, so then we'll go into item 5, the presentation by Dr. Hughes for the state of public health. And then after that, we'll circle back around and approve the minutes and action items.
Sounds great. All right, well, it is State of Public Health Month, so we're very excited to give you a rundown of some of the work that's been done in our department over the past year. We're going to hit the high points anyway. And any questions you have, I'll have a little bit of time after the presentation for that. The first thing I want to note is just this year is kind of a reset year. So we're trying to align a whole lot of different pieces of data so that our state of public health is more cohesive, along with like our community health assessment, our strategic plan. It seems like we have kind of a lot of different places that we can have information and data and goals and that kind of information coming to you, and we really are trying to streamline that. So this year is really kind of a reset year, and we want to really take some time to celebrate the great work that is happening in our department, because I think it'll set a nice foundation in years to come for where we're going to go. So to start out, we are going to just cover really quickly what Douglas County looks like from a demographic standpoint. So this is from 2022. Our population is approaching 600,000. If you include the surrounding counties that make up our metro, we are getting very close to 1 million people, and we expect that we probably will hit 1 million people here in the next few years. So Douglas County is definitely growing, and of course, we work very closely with Sarpy-Cass County Health Department and also Potawatomi Health Department in Iowa as we kind of plan and talk about public health in the region. But here we can see that of those 586,000, we skew a little bit to the younger side in terms of age. You can see that we also skew just a little bit higher on the household income. The median income in Douglas County is $74,000. The population predominantly white. However, we do have quite a bit of wonderful diversity in our community, including Black, Hispanic, Asian, American Indian, and others. And so we do have kind of a beautiful, colorful community. The most common levels of education include a bachelor's degree and some college. So we do have a fairly educated population. This is just showing again that Douglas County is growing. It has been growing pretty much always and continues to do so. So again, we expect to see that population, at least for the metro area with the other counties that comprise that metro, to exceed 1 million here in the next few years. I think it's always worth revisiting the definition of public health, and honestly, there are a few of them out there, but I really like this one. Public health is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals. And the reason I really love this definition is because it focuses on choices of many, many, many entities. It's not just the health department kind of back in the corner trying to push health. Public health really takes everybody in a community to really build up the environment in which people can be healthy. And so I really like this definition for that. So we're going to jump into the work that our programs are doing in Douglas County. So we'll start out with epidemiology and emergency response. So it's important to keep in mind that individuals of all races and genders and ages are at risk for communicable diseases. Bugs don't care. They will infect anyone who is susceptible. Outbreaks of communicable diseases can have not just serious impact on human health, but can also be very costly for our communities. So we aim to reduce the potential for illnesses and deaths, minimize transmission of diseases, and then, of course, lower healthcare costs for our entire community. In 2023, we had over 1,300 cases of communicable diseases that were reported, and there is an actual list that is put together by DHHS that is basically a list of all communicable diseases that are required to be reported to the health department. So that's this list that you see here, or the number that you see here. 689 of those investigations were those cases of disease were investigated. Not all communicable diseases need a case investigation, but 689 of those did get an investigation completed. There were 24 outbreaks that were reported and investigated, and then we did over 1,900 DOTs, so that's the directly observed therapy that we do for patients with tuberculosis. So it's quite a long treatment, and to ensure people are able to stick with their treatment, we actually watch them take their medications and follow up to make sure they're not having any bad side effects, or there aren't any reasons that are coming up that would cause them to stop taking their medications. So we kind of case manage just a little bit if there are things like that going on as well. All right, we talked a fair amount about this while it was going on, but we did want to highlight some of the great work that has happened in emergency response this year. So we did have a stray kitten that tested positive for rabies. From that, we had 10 potentially exposed humans that we were able to prophylax. We, of course, don't know how many animals could have been exposed. And because we didn't know that, we undertook quite a large response that was comprised of 15 local, state, and federal partners. We ended up distributing over 18,000 oral rabies packets, hand vaccinated 804, and tested 360. And happily, we did not find any other animals in Douglas County that had raccoon rabies, which is great because raccoon rabies has cost millions and millions and millions of dollars to control on the East Coast, and we don't want that problem here. So we were, it looks like, able to mitigate that from happening here. So just for perspective, this is kind of going back to why it's so good that we have people who are able to respond and prevent these things. The annual cost of rabies prevention is around $600 million, which is a lot cheaper than what you would see if people actually were having rabies, not just in terms of the fact that it's almost always fatal and would have impacts to those families, but just extremely, extremely expensive to treat in terms of the course of treatment, hospitalization, supportive care, and things like that. And the average cost to treat a person, so to give them the rabies prophylaxis, is about $7,800. That's a little, I think, on the high side, but you never know if it's going to be one of the more expensive cases or not, and so we'll estimate it there on the high side for you. But we did some incredible work to prevent illness, death, and really further issues related to rabies in our community. So we're very proud of our team for that. We also had a large tuberculosis exposure that we investigated, which I'm sure you all remember back in November. This is a little bit of a time frame that we wanted to show you because we're quite proud of how quickly we were able to respond and collaborate with our partners. So we were notified on November 6th at 3 p.m. and we were able to, we were already responding before we actually activated that unified command where we're bringing more leadership from outside into the process. But within a couple of days, we had unified command activated. We had notified all of the patients and providers by November 9th, and then that evening we had a public info session. So tried to ensure we were getting information out to affected families as quickly as humanly possible. I think that our ability to communicate directly with the community in both this and that rabies event are a couple of the main reasons that we were able to be so successful. So we're very proud. We were able to notify over 500 exposed individuals and their families within about 72 hours. So that's pretty incredible. And then that same weekend, Children's was able to hold a clinic for the higher risk children that needed to be tested and put on window prophylaxis. And then the next week, we were able to do our own testing clinic. And so it's pretty incredible how smoothly and quickly that response was able to occur. And all in all, we were able to identify 643 people who were exposed. We were able to do complete testing on 319 people, and there were only 2 positives that came out of that, and those were both household contacts. They weren't community contacts, so that's wonderful news. And again, that was a fantastically successful response. Moving on to lead poisoning prevention program. We have been focusing quite a bit on community partnerships to combat lead poisoning, and there have been some changes from EPA in terms of acceptable, well, there's not an acceptable lead limit, but they've changed the threshold at which we do certain things like testing. And so we have a lot of changes coming up from EPA, and so it's good that we have a very strong program for this. So the main goals for this program in 2023 included increasing blood lead screenings in children, decreasing exposures to lead-based paint, and increasing awareness about lead in spices. So paint and spices are 2 of our main avenues through which children are exposed to lead here in our community. So these are some of the partnerships that we utilized in order to get our goals achieved this year. So we did see a decline in children screened with blood lead levels, so we preferred to see that. We want fewer children who are screened to actually have high blood lead levels. So 30.62 in 99 versus 1.14 in 2023. And then the local partnerships to improve screening, we actually are doing lead screening at our WIC sites. Nebraska Methodist College in Creighton has assisted with some testing. We've also offered some testing through immunization clinic and outreach events through Douglas County Health Department. We were able to provide free lead 2 analyzers to Creighton College of Nursing. And then we are working to improve blood screening guidelines for pregnant women who are at high risk. And just as a very quick refresher, lead exposure is problematic, especially for our children, because it does cause damage to the nervous system. It can impact their ability to solve problems. It can impact IQ, hearing. It can cause learning disabilities, as well as damage to some of the other systems in the body. So it's very important for us to catch this early and get it treated as soon as possible. This map probably looks familiar because we show it to you, I think, every year. But last year we had 298 confirmed cases of kiddos whose blood lead levels were above 3.5 or higher. Most of those were in the 11 zip codes that are colored yellow that you see here. And 68111 remains our zip code with the most prevalent cases, and most of those are associated with paint. Some of the other activities that have been going on to prevent lead poisoning, again, lead paint still remains the #1 source. So for pre-1978 housing, and most of that housing is actually east of 72nd Street, so that's where we tend to focus our efforts. But we do provide free Swiffers for homes with lead-poisoned children to clean up the dust from the paint. We also provide HEPA-filtered vacuum cleaners for those impacted. And we work very closely with the City of Omaha's lead hazard reduction program. We refer them to the city pretty frequently. And then again, we actually have people who go out to these homes and work with the families to educate them and help them put together a plan to remediate any of those lead issues in the home. So people are often surprised to hear that spices are kind of the second leading cause of lead poisoning here in Douglas County. And this mainly affects our refugee populations and immigrant populations. Oftentimes they're bringing, cooking implementation and spices and things like that from their home country with them. And there unfortunately can be lead present in those spices depending on how they are put together. And so we are working to increase state and federal awareness around that. You probably remember the applesauce recall that happened not too long ago, and we did work across programs in the health department to make sure that our food safety folks were able to go out and pull applesauce off shelves if necessary. Our lead team also presented at the APHA conference. We've also been collaborating with UNO to stand up some citizen science, which is basically when we're educating people in the public to kind of take issues into their own hands to fix an issue or to address an issue. And then we've also worked with some chemistry students who were able to collect and test spices for lead. So that's a pretty great opportunity for them. And we have a very nice brochure about it, which is available at the health department. Moving on to sanitation control and engineering and air quality. So air quality, I think this is a great topic because we had horrible air quality yesterday. It was pretty gross out there between the smoke from Canada and the cottonwood trees seeding. It was kind of gross out there. We were able to partner in developing guidance for youth activities. So we do work with area schools to ensure that they know what air quality looks like. So if they need to, they can change the activities that are planned for kids. We have an email-based 2-day air quality forecast system called enviroflash.info. We also are utilizing a Twitter account so that we can do instant notification of air quality events to the public so they can get that information as quickly as possible. We also partner with the National Weather Service to use the alert notification system for air quality events. We really are focusing heavily on making sure that the public has many avenues of knowing what's happening in terms of our air quality here in Douglas County. And we partner with the state on statewide notifications, trying to make sure we're kind of marrying up our messaging there. And we are working with the Omaha Climate Action Plan to further develop and refine those communications when it comes to air quality. So a lot of work happening in our air quality. And just as a reminder, we have 7 monitors here around town, and they all monitor kind of different things. Lots of particulate, but then we also have some that test for different pollutants that are close to the interstate and things like that. So we have a pretty good eye on what's happening here in Douglas County. This is just a quick statement from the Health Services Director, Lori Bauda, over at OPS, and this is one of the school systems that we work with very closely. So they were able, Omaha Public Schools collaborates with Douglas County Health Department Air Quality Department when there's a potential for poor air quality. The air quality team is quick to respond and provide guidance to ensure the health and safety of staff and students during outdoor activities. And DCHD air quality team connects the district with resources such as the Air Quality Index forecast to facilitate independent monitoring of air quality. And OPS is grateful for the ongoing support of Douglas County Health Department. And likewise, we are very grateful that OPS utilizes us in this way. All right. Moving on to food safety and compliance. So our food safety and compliance team serves about 13.3 million people annually when you take into account all of the people who come through Omaha. So yes, we have 600,000 people who live here, but there are many, many, many visitors, over 12 million visitors to the area every year. All of those people have to eat. So we need to make sure that the food that they're accessing is prepared in a safe way. So they provide restaurant inspections, mobile unit and farmers market permits, and food safety training to our area food establishments. All right. One of the biggest pride points that we have in the health department is that we are very much on track in keeping our restaurants all inspected and safe. So there's actually a study, Inspection Laws, Risk Factors, and Foodborne Illnesses, that was conducted by Dr. Herzberg of Northeastern University in Boston. And that study did show a direct correlation between the number of inspections and the frequency of foodborne illnesses. So we know that staying up, keeping up with the inspections for our food establishments is incredibly important and has a huge impact on our community. We were able to conduct over 5,000 inspections each year, and more than 99% of those are up to date. So that is kind of unheard of. A lot of times, you know, it can be very challenging to keep up on inspections in a community, and most are behind a bit. We've really had a great effort to make sure that we're up to date, and that translates directly to a healthier and a safer community. One of the other wonderful things that we were able to accomplish in food safety and compliance this year is that we were able to hire in 2023 an individual who is our community educator for food safety. This person is currently transitioning from his training. So we've trained him as an actual food inspector, and then are going to utilize him to help put together educational opportunities for our food establishments here in the community. So this is kind of a pilot project that we're doing, and it will help us really to transition from being an enforcement type of entity, so going out and enforcing food standards, to really being one of collaborating and educating and helping food establishments to really take on ownership of food safety within their agencies. So this is active managerial control, essentially, and hopefully they can kind of self-identify when there are issues and then work to mitigate those issues that are happening in their own facilities. One of the wonderful things about this position is that it is also Spanish speaking, so we do have a large proportion of food establishments that are Spanish-speaking staff, and so this person will be able to work a lot more collaboratively with not just the people who work in these restaurants, but also doing so in a way that is culturally responsive and respectful. So we're really, really excited about having Rodrigo Sanchez on our team. Moving on to our Division of Health Equity and Planning. So this is our Health Equity Office, who also does our plans. And let me get transitioned here. So the division, as you know, is a newer division that we have stood up. And the reason that we did that was really to ensure that health equity is something that is woven throughout our entire department. It's not just checking a box. It's not, just kind of we have it because we said we hired this person kind of scenario. We really, really want to take it seriously and ensure that we are an agency that respects and cares for all people regardless. So the vision of this particular section is really around being holistic, seeing the whole person, and not just the whole person, but the whole community, to engage in an active and authentic way, to impact in terms of advocacy, to be able to tell our story a lot better and to help others to tell their stories well, and just to really foster collaboration within our community. This is a little bit of a timeline for you to see kind of the work that has happened in this division. So one of our great successes this past year has been that we've beefed up our ability to communicate well with our community, and that means language access in languages that people speak. So Lingua is one of those avenues through which we're able to accomplish translation. We also were able to get Marty on board, which is it is an interpretation service that is video-based, so we are able to, in a couple of hundred different languages, we're able to offer people interpretation on the spot with a live person on video in whatever language it is that they need. We've also utilized our division for interview assistance. So we often have members of our health equity team that are serving on our interview panels to make sure that our hiring practices align well with equity. We've been making progress on racism as a public health crisis and those 22 action steps. And I think later in the year, you'll probably get to hear a more in-depth presentation on that. We've also been working really hard on workforce development and really putting together things like a better orientation plan for our new hires that come in, having a more comprehensive onboarding so people can feel successful immediately. And then they've helped in a number of ways, especially with anytime we've had a response in the last few years, our health equity people have been at the table to make sure that as we're working through response work, that we are taking everybody into consideration when we're strategizing our way forward. This team also is heavily involved with community advisory meetings, accreditation. This year we were able to finally submit our package for accreditation in March. We are currently awaiting news of when our site visit will be, and this division is directly responsible for pushing us to at least that milestone. So we're very excited about that. They've assisted with dashboards and are also really pushing forward our performance management and quality improvement. All right. A couple of other notes that I have on our Division of Health Equity is that we are really wanting to advance a people-first culture. So it's important that we all remember that we are here to serve our community, and the people come first. We also want our workforce to be really, really well taken care of. We also want to ensure that we're not just staying stagnant, that we're able to grow. And again, that is something that our Health Equity Division is helping to enhance and push forward. And then, of course, organizational sustainability is a big deal. So they're doing a lot of work around making sure that our people who are in our department are really well-versed in public health core competencies and have what they need to grow and be successful. Okay, moving on to health data and vital statistics. So our vital statistics section handles birth and death records for Douglas County residents. And one of the really neat things that we are able to do with this section that people probably don't know about is that we are able to repatriate the remains of loved ones who may be from other countries but have passed here in the United States or here in Douglas County. So we work with other homes to make sure, or we work with other agencies such as funeral homes to help get that accomplished. And in 2023, we were able to repatriate loved ones for 40 families, and there are a number of different countries, and some of them have very different ways that different paperwork we have to sign and things like that. But our top ones were Mexico, Guatemala, El Salvador, and the Philippines. And we love that we're able to give families in other countries the closure that they need, by receiving their loved ones back when they've passed. So that's kind of a neat service we're able to accomplish here with our vital statistics. Moving into health promotion, we'll cover some overdose prevention. So overdose fatalities have unfortunately increased in Douglas County by over 100% from 2019 to 2022. We started out with 39 in 2016, and that has increased pretty steadily to 104 in 2022. We are working to address overdose through a few different avenues. First of all, the Overdose Fatality Review Team is really a system that's put together to effectively identify system gaps and innovative community-specific overdose prevention. So part of that is being able to get good data and ensure that the Overdose Fatality Review Team is able to look at all of the data in order to identify those gaps. Previously, we did not have the ability to get all of the data that we needed. However, our health promotion supervisor and our chief over health promotion were able to work on legislation last year that would ensure that we were able to get this data. And that legislation did go through the first time, which we're very proud of since that doesn't always happen. And so the legislation Overdose Fatality Review Teams Act was passed in June of 2023. So we're very, very happy about that. We also received the OD2A local grant. So this is really linkages to and retention in care, harm reduction, stigma reduction, clinician and health systems best practices, and surveillance. So there are a lot of different pieces that are happening under this grant, and we are really working with a number of agencies within the community to make that happen. And then again, like I said, the OD2 or the Overdose Fatality Review Team is something that we actually stood up a couple of years ago, and we were able to, now that we're able to get the data that we need to actually have this team function efficiently, we were able to formally launch that and get work happening with that. All right. This is some of the other work that's been happening in health promotion. So we have a team of community health workers that are out in the community, and they do some really, really wonderful work. 464 client referrals were made in 2023. Sorry about that. So basically, these are all individuals who came to or interacted with our community health workers and needed some kind of connection to other services. We made referrals to local pantries for food assistance. We made referrals for rent and housing. We've given assistance in accessing care, helped with enrollment in different programs and services, and also provided some interpretation assistance. We've had a couple of big projects that have happened in our community health worker section. Project New Lens is one that you got to hear about just a couple of months ago. So the pilot for that was successful, and we are kind of in our second phase of planning a larger application of the Project New Lens, and then the diabetes prevention program is ongoing as well. A quick success story for you on that, on the diabetes prevention program. So we're able to work with a number of different agencies, including One World, to offer those. And we are actually offering that in more than just English. So one of our community health workers translated the entire program into Burmese so that we can offer that to our Burmese population, and then one in the Karen language. One of the participants for the diabetes prevention program had said that, you know, she had a family history of diabetes, and she was able to really learn a lot, lose some weight, get diabetes, really, you know, to get herself to a place where she was able to prevent diabetes. I'm sorry, I need just a moment. I'm feeling a little lightheaded.
I've been scrubbed in surgery before, and I've had it like sit on the floor. I can't. I'm sorry. In surgery, we have one doctor that we say it's Dr. Park's effects because everybody that scrubs it with him ends up on the floor.
I feel like I am pouring sweat right now. Thank you. Maybe. Bless you. Yes, let's just blame diabetes. You guys are awesome. Can I just take you with me everywhere I go to fan me?
That would be an interesting proposition.
Oh my goodness.
Oh, you are really diaphoretic, aren't you?
Napkin.
Oh, okay, yeah. I have sweat in my eyes.
Ooh. Tissue? You need
Yes,
Kleenex?
somebody's getting some.
Yeah, they're getting some. Oh my gosh.
I did notice it was warm for a couple minutes earlier, and but
I'm really glad they can't see
This-
me on camera right now.
has this happened before?
No. I don't think I've ever. Oh, thank you.
She got health professionals around here, right?
Don't put this in the
I think-
paper, Julie.
I think we've stopped. We're not. We've stopped that. All of it.
Okay, I think I better.
Your brow is still really.
I'm sweaty, yeah.
Yeah.
Yeah, and if you want to kick your feet up, you just relax for a minute. Seriously. Don't feel like
Yeah,
you need to rush.
yeah.
Oh, I don't know if I can do chocolate right now. I might throw it up.
Oh.
The orange juice is good though.
Okay.
Yes. Muted? Okay, let's see. I think. Mute the microphone. Over.
No. Just sudden dizziness and nausea.
Mute.
I'm diabetic, so I might have gone low.
Can you hear me
One of
now?
the meds might have just hit it the wrong.
It. I thought it was on mute.
Yes. It's much better.
The controls are disabled. We can't mute this.
Oh, it's fine.
It's disabled. She's the techno.
Oh my goodness.
Weird. Yes, close. It says it's disabled, Jeannie.
And now our
screen has gone black.
Mute the Zoom.
Yeah.
How many people are on Zoom? So are we able to tell them what's going on?
I did. I said.
Put a
please
flair
mute.
for the dramatic.
Okay.
So I've muted the
Goodness gracious.
audio for the.
Yeah, okay.
Well, I feel a lot better now.
Well,
No, you're fine. Trying to find out why our audio and our video went
It's a
black.
good thing I'm hard to embarrass.
When you're in healthcare, you've seen it
Yeah.
all, done it all.
yeah, but
And as a mom.
Oh, yeah.
still. Oh my gosh. You're just really cool when you're struggling.
Yeah.
How about we now, since we have a quorum, we can pause your presentation
business?
and you sit here and maybe Phil can sit here with you or Leah or somebody
Yeah, I'll sit
and,
there.
and we'll do the business portion of it and then see how you do. Because we don't want to prolong you having to be here in the first place. So, does that seem like a plan? Are you going to be okay? Here's a fan.
I feel better.
Okay, yeah.
I'll probably take my shoes off.
Good.
Please take your shoes
Okay.
off, sit down to do the rest.
Okay, and if you need us, you raise your hand, Phil.
Hey, I'm not sure how much fanning I can do.
Well,
Maybe
I-
so. That sounds actually great.
This is, oh, business services. Okay, building services. Okay, this is Heather with the Douglas. Caramels. I don't know.
Vending machine. I think the chocolate was nauseating for us. Okay.
Chocolate's too nauseating, yeah.
Too basic. Do they have like toast or?
Chips, crackers.
Crackers.
right, I don't know if I'm talking to anybody. But we are, sorry about the, a little bit of a curveball thrown at us here, but, so we're gonna pause the presentation for right now and circle back around to do some of the business side of the meeting today. First off, now that we have a quorum, we can vote to approve the minutes of last month's meeting for the Board of Health. Can I get a motion for approval?
Second?
A second? That's all right, yep, sorry.
Wilkin?
Lindsay White for a second.
Yes.
Yes.
Yes. Yes.
All right. Is there any reason not to approve action items A through L together? Does anybody need to pull any of them out for any reason? So can I get a motion to approve the action items A through L?
So moved?
Second. Yes.
Yes.
Yes. All right, so that was the official voting part of the meeting. Do we want to table the rest of the presentation, or probably, yeah, and maybe continue the last part this next month's meeting? Apologize about the curveball now that Zoom's coming back online here. So our next meeting is scheduled June 12th. I don't think there's a... Okay, yeah, we were wondering if that was the accurate. So the next month's meeting will actually be... Okay. Oh, okay. Okay, so the note on that it will actually be June 12th, a week earlier, and it will be held at the Health Department for that 1 month in June.
I can just, the rest of that is my stuff. Do you just want me to go through, I don't know all the details, but at least I can kind of go through the basics of what's on the rest of it? Because I believe it's almost all my division that's left. It's up to you guys, though. I'm just throwing it out there.
Yeah, what are you referring to?
On the presentation.
Oh, I see, okay.
And Dr. Hughes has her notes up here.
It's up to you. I'm just throwing it as an option.
That's fine with me.
Okay, yeah, that's fine, yep.
Okay.
So we'll circle back around to the end of the presentation.
And share screen.
Figure it, one less thing that we have to worry about next month.
So we'll just present this and she just have this here so she can look at her notes.
Okay. Where did she leave off on? Okay, I'm just gonna skip, then we'll go to infant health, if you guys are good with that. Give me one moment till I figure out her computer. Okay, so we'll start with infant health. So we had Baby Blossoms come together in 2023, and then we also had a pause on it in 2023 just due to staffing reasons.
we're still working on getting that brought back up and continuing the Baby Blossoms Collaborative so that we can be moving forward in the maternal child health space. And our infant mortality data, as you can see, there's still high disparities happening. We are, our case review team, we reviewed 8 cases in 2023. In June of 2023, the Nebraska legislature passed the review of stillbirths, which was removed in 2013. Stillbirth is those infant born without signs of life, generally after 20 weeks of gestation. Let's see. So we're working on a strategic plan for our Baby Blossoms Collaborative, just so that we can still be moving forward while we are searching for staffing to assist us in these, in this space. So, oh, hold on. There's 2 things I'm clicking. So, the position has been posted and it is up now if any nurses are interested in our fetal infant mortality review team. Okay. I won't lie, it's weird. I've got 2 things I have to click on, so apologies. So for WIC, as you can see, we have our unduplicated participation at about over 22,000. And you can see the breakdown happening here. Our local agency WIC programs is the Douglas Sarpy Women and Infant Children Clinics. It serves all of the Omaha metro area. Anyone who resides in Nebraska can participate in our WIC local agencies. So we've got 4 main sites. Our Midtown over at Center Mall, West Omaha is 120th and I, Charles Drew Health Center, One World. We also work with Nebraska Medicine's Olson Center and the Sarpy-Cass Health Department and Offutt Air Force Base as well. One thing to note is in Nebraska is about over 60,000 persons are eligible for WIC. 35,000 people participate in WIC, so that's about a 58% coverage. And if you look at the numbers of our actual participation, we have a large chunk of that. So I'm really proud of our WIC team of constantly, I know their schedules are jam-packed, so we are happy to have this service and providing the best we can to our community members. So for our here we go. Breastfeeding support. This is one area that we are really pushing hard to increase. As you can see in 2022, our rates were just slightly above the national breastfeeding rate, but as Douglas County, we want to exceed that. And so we have been bringing on some breastfeeding peer support members, and we are excited to have some of those folks on board and hopefully see an increase in our breastfeeding rates here in Douglas and Sarpy. So for rates of breastfeeding, just so you guys are aware of, our white non-Hispanic is about 21%, black non-Hispanic is 17%, and our Hispanic breastfeeding rate is 30%. Okay, so moving on to our STI control and immunization clinic. So our immunization clinic ensures access to vaccines. And as you can see with our COVID and Mpox, we had a huge number in 2022 with a kind of drop in 2023. So the interest in the Mpox vaccine has waned as the number of local and national cases has decreased. This is a national trend that we've seen. Only about a quarter of eligible at-risk individuals have completed the 2-dose series. Interest in our COVID-19 vaccines have waned just as the virus and the number of local and national cases have decreased as well, also national trend. Starting in September of 2023, we had the release of the new 23-24 formulation of the COVID vaccine, and we've been able to administer to those individuals that qualify for our Vaccines for Children and Vaccine for Adult program. We continue to screen and encourage clients to receive the Mpox and COVID vaccines. If eligible, we are providing those if you fit into our VFC, VFA programs. And we are doing promotion at community events, social media, etc. So our vaccine for children increased from 2022 to 2023. You see from 818 to 900. And then our vaccine for adult numbers decreased from 2022 to 2023. We had over 1,200 and just about a little over 900 in 2023. So for our STI transmission rate or STI incidence rates, prevalence rates here in Douglas County, our gonorrhea rates have gone down slightly and kind of plateauing. We've got our chlamydia rates that are pretty much staying along the same course that they've always been. And then syphilis rates have really been where we've seen the increase happening. As for note with our syphilis rates, these are infectious stages. I know I could go into a whole long story about infectious versus latent, but these are the ones where it is highly transmissible if exposed to an infectious syphilis individual. So we're seeing those rates increase. As you can tell, we are pretty high above the US and Nebraska average when it comes to gonorrhea and chlamydia. This has been a trend for how many years now? Now to get into with our clinic, we have actually seen a pretty big increase in our clinic visits from 2022 to 2023, from 2,953 to over 3,800 in 2023. We've had a loss of funding in our STI clinic and control offices, but overall we're still increasing our clinic visits, which I'm really proud of the work these two teams have done. We did implement a new clinic EHR, which is putting us in the 20th century, it feels like, but you know, we're a step behind, but we're excited that this is now started. We're looking into having self-scheduling, a patient portal, text messaging, so all these things that we can be able to better communicate with our clientele that come. Now for our control program, some of the other things that we're doing that have been pretty innovative for addressing STIs in our community. Our at-home testing program has really taken off. We did have to put a pause as we had some staffing switchovers, but this is something we are piloting and validating some at-home collection techniques. So in the past year, we had about 519 requests for our at-home STI HIV program. 385 of those folks received education, and then we mailed out 206 STI test kits. The crazy statistic to me is that 16% of those were positive that we mailed out. So that tells me we're really finding folks that need this service and providing it to them. As a caveat, we do tell folks if you have symptoms, come into our clinic. So these are typically asymptomatic individuals that we're testing through this program. As you see, we had about 165 of those individuals referred to our clinic as well. So really proud of this, and we're going to be continuing this as we move forward. Our outreach and education program, we had about 600 events conducted in 2023, over 8,400 people reached, over a 3% increase in our condom distribution, and approximately 500 outreach tests.
Leah, of those home test kits, is my understanding, excuse me, they're sent back to the health department? I mean, after the lab, the health department knows the results of the home test, and then you notify the individual?
Yes, so those test kits, there is an online request form. Folks can go on, request a test kit. We have one of our prevention specialists basically call those individuals and say, hey, what are you interested in? What kind of piqued your interest in knowing why do you need a test? What kind of sex are you having? And then we send all the materials necessary for that. So it's tailored to that individual. Those test kits are mailed. And then if we don't get something back within a week or two, then we're calling that individual saying, hey, did you have any questions? Can I help with anything? And then we'll hopefully get those test results back, and then we submit them to the lab for testing.
And then after they're identified, what's the follow-up from the health department?
Yes. They are then followed up with our team of disease investigators and going through the case investigation, yes.
And so you call the individual and say, your test results indicate you are positive for
Yep.
ST. And then they're encouraged to seek a healthcare provider, or?
We
how do you
always tell
decide?
folks if they test positive through our outreach programs, we call them. We say, no news is good news. However, if you do hear from us, please come in. We get them tested. So then we refer them into our clinic for treatment and then through that process. What was that? So we test for chlamydia, gonorrhea, for throat, rectal, and urine. And then if someone needs an HIV test kit, we do have at-home Oraquix that we send with that kit if someone's expressed interest in it. Unfortunately, we don't have syphilis included in that just because of some of the testing nuances with syphilis. If it's a point-of-care test, it's harder to determine if it's a new case or not if they've had syphilis before. So we're working on trying to figure that piece out. Yeah. Yep. Any other questions on that piece?
Just one last, of those individuals that tested positive, how many of those actually came to the health department?
I'd have to find that number for you. I don't
Right,
know it
I'm
off the
just-
top of my
okay.
head. I know that we do have a fairly high treatment adherence rate, but I don't know specifically, so I'd have to get it for you.
Sorry, last question. Is there a cost, did you mention if there is a cost for the home test kits?
It's free.
And then when they come in for the visitation, is there a cost for the treatment?
For treatment, if it's, we have to do a full visit follow-up for the collection validation right now. And so we request a $25 clinic visit when they come in. We don't turn anyone away. So, Dr. Wilkin mentioned about the treatment. I can tell you about syphilis treatment. I just can't tell you specifically about chlamydia gonorrhea one. So, we have about a 99% infectious syphilis cases have received treatment due to our disease investigation. So I'm very proud of that number, always have been. Our STI control team has really focused in on getting those treatments into folks. So as for investigations, interviews, syphilis investigations, there have been over 650, infectious with over 75%, and latent 56%. Now, our chlamydia, gonorrhea, basically we just follow up. Because of the high syphilis numbers that we've been investigating, we've just been following up with providers on treatment for chlamydia, gonorrhea, because syphilis investigations have taken over our DI workload. So we do follow up with our clinic patients that come into our STI clinic. We do follow up with them, but outside providers, we do not with the actual individual. And as I mentioned, with treatment, almost 99% infectious syphilis has been treated, and just over 87% of our latent syphilis has been treated. Thank you
Any
for
other questions from anybody? Thanks for being the pitch hitter. One question.
Just out of curiosity, in previous reports, and it's been a few years, but we would have a YRBS update. Do you have any information about the kind of status of what's going on with YRBS?
I'm going to look to Jamin for that one.
I don't have anything directly. I'm willing to follow up with you offline about YRBS.
Just a quick comment for the health department and for the volunteers that attended the Cinco de Mayo this past weekend. I did see that Douglas County had several volunteers there. They were giving out great information. I was there with CHI as well, providing some health information for the community, and just very, very thankful for those volunteers that take the time to be there. And they provided free condoms, and they provided information in different languages. So that was very well received by the community. So I just want to, if you can extend, thank you from the community. Thank you.
Great. Well, thanks, Leah, again for
Like I
finishing
said,
all
I
that
was just
up.
trying to help. I
All right.
didn't probably give as much details as Dr. Hughes would have, but
I appreciate that. So I think with that, we just need a motion to adjourn.
So moved?
Second? Yes. All right, and hopefully a little less exciting meeting this next month. So we'll see y'all then.